Let's talk about ankle arthritis. This is a really common problem that I see regularly. The ankle is a joint that moves a lot, takes a lot of pressure and forces, and is often injured. That does predispose it to wear and tear arthritis, otherwise known as osteoarthritis. There's lots of different levels of ankle arthritis, and in order to tell you what is happening with your ankle, I would need to see you and examine you, have a weight-bearing x-ray of the ankle, and potentially an MRI scan. Not always required, but sometimes that helps to make the diagnosis, particularly in the earlier levels of arthritis. The treatment for ankle arthritis, as you can imagine, very much depends on how bad it is on the imaging and the examination, but also, most importantly, how bad it is for you. When it comes to treatment, you yourself can make a big difference. Getting a rocker bottom shoe can really help. There's lots of different companies that make these. Examples would be Hoka, Asics, Skechers, MBT. Essentially a trainer where the toe and the heel are off the ground, and looking at the sole from the side shows a rocker. That means that the ankle doesn't need to do as much movement when you're walking because the movement comes through the rocking motion of the shoe. That can deal with ankle arthritis from very mild to very severe and is an excellent way of avoiding surgery. I'd thoroughly recommend that everyone tries this first. Sometimes an ankle brace can be useful. I tend to recommend an Air Sport or Air Cast A60, otherwise known as the Andy Murray brace. This is worn when one's exercising and again decreases the range of movement of the ankle, trying to decrease the pain from the damaged surfaces rubbing over each other. When it comes to what I can do for you, I would start off with diagnosing exactly what level we're at. If the ankle is at essentially any level of arthritis, we can try an intra-articular injection, which means putting some steroid and local anaesthetic into the joint to try to decrease inflammation. In some people this works brilliantly well and that's all they need. In other people it works but only for a temporary period of time. When it comes to surgery for the ankle, again, it does depend on how bad this arthritis is. It can range from arthroscopic treatment, which is keyhole, right through to ankle fusion. Ankle fusion is where we remove the joint and stop the damaged surfaces moving over each other and stop it causing pain. I'd be very happy to see you and look at your ankle, provide a diagnosis and a treatment plan if you would like.